Can you walk with a torn ACL? Well, it really depends on what phase of healing you're in. This is a phases of healing chart for the ACL that I use with my clients. And on the earlier phases over here, where there's a lot more swelling, pain, discomfort when you're up on your feet, it is not a good idea to be walking for exercise or for any sort of treatment for your ACL, because the ACL is designed to hold stability in the knee as it's bending. And that's exactly what you have to do when you're walking. You have to bend your knee and use your leg, push through your knee. And if the ACL is not happy, it's not in great shape right now, then it's not a good idea to be using it. In fact, what you should be doing is using something like this to get around and pick up your leg and put your leg in a brace, your knee in a brace, so that you're not using that knee very much, so that you can let it heal. By walking around on crutches and bending that knee, then you're allowing your ACL to heal. But once it stops swelling, you've gotten the pain under control, you've gotten the swelling under control, then you're entering in the later phases of healing. You've got to begin to challenge it gradually. So then it would be a good idea to begin to walk, to challenge your ACL, to get it to be stronger, and to begin to walk better, of course. But one caveat that I always tell people who are beginning to walk after an ACL tear is that you need to learn to walk correctly by using the right muscles, because a huge problem is muscle imbalances. If you have a muscle imbalance, which is very common in those that have ACL tears, where your quads are dominant, your quads are very strong, and other muscles, especially the glutes, the butt muscles, and the foot muscles, if those muscles aren't strong enough and the quads like to dominate, then you're going to be adding excessive tension to your ACL when you walk, and you could be feeding into your next ACL injury if you don't fix that muscle imbalance. That's something that we teach people here in our program. So be careful on when you're walking, what phase you're in. Don't force it to happen if it hurts. It should not hurt to walk. You need to make sure that you're off the leg if it's hurting when you're up on your feet, and wait until you're ready. Wait until you heal enough, and then you need to make sure to fix those muscle imbalances so that walking can become helpful for you because you're using the right muscles, rather than harmful because you're using the wrong muscles and putting tension, too much tension, through your poor ACL. If you want to learn more about our treatment approach in all these phases, this is in our program called the ACL Tear Recovery Program. There's a link to it in the description below. It's over 40 videos of me walking you through the process, the treatment approach that I use to help my patients heal naturally from ACL injuries. And even those that have had an ACL reconstruction, but they're done with all their health care, seeing the surgeon, seeing the physical therapist, but they're still having problems afterwards and they're concerned of another ACL injury, this program is for them as well. I've also got other videos to help people with ACL tears that are on YouTube here. I've put them all on a playlist called the ACL Tear Help Playlist. You'll find that link in the description next to our ACL Tear Recovery Program link.